Okay, so I've washed my hands and cleaned my stethoscope, and I'm just going to go over the patient's MAR before I enter the room. So here I have Rita Wilson, and her date of birth is January 23rd, 1944. She's a 72-year-old female, and she has no known allergies, diagnosis of gastritis and gastroenterovirus, and she has some PRN medications here, Gravel, Tylenol, and morphine sulfate. Okay. Hi there, Mrs. Wilson.
Hi.
How are you today?
Good, how are you?
I'm good. So my name is Rihanna. I'm going to be your second-year student nurse today. Can I please get you to tell me your full name and your date of birth?
Rita Wilson, January 23rd, 1944.
Perfect. Okay. So I'm just going to do a quick safety check of the room. So I'm just going to make sure the bed brakes are on and pull the side rails up. This bed, the side rails don't go up, so in a real scenario, I would raise the side rails. This one as well does not go up. Now I'm just going to check the oxygen here, make sure it's flowing. Perfect. And the suction is working as well. Yeah, definitely working. Okay. Alrighty. And I would also ensure privacy for the patient. And okay. So, Mrs. Wilson, I hear that you're having some nausea this morning. Yep, okay. So, you do have a PRN medication for some Gravel.
Okay.
Yeah, I saw that you were given 50 milligrams about 4 hours ago. Does that usually work for you?
Yeah, that worked really well. It made me feel better.
Okay, awesome. So I'm just going to come over and check your IV site here. So I'm just going to check the pump here for what's already hanging. So we have sodium chloride here, normal saline for, I'm just checking for the compatibility with the medication. Do you have any allergies at all, Ms.
No
Wilson?
allergies,
No, okay, perfect. And so I'm just going to check the tubing and make sure the tubing is all proper. Yeah. And I'm just going to check your IV site as well. So I'm just looking right now for any redness or swelling, which could indicate phlebitis or infiltration. Mrs. Wilson, do you have any pain at your IV site at all?
No pain.
Okay.
It feels good.
Okay, perfect. So I'm going to go get that for you, your medication, and I'll be right back.
Okay, great. Thank you.
Sanitize my hands. Okay. All right. So now I'm looking at the orders here. So the 50 milligrams of the diamond hydrogenate, and I'm looking also at my IV monograph card. So I have diamond hydrogenate here. It says for the intermittent infusion for adults, we dilute it in a 25 to 100 ml mini bag, which I have right here, 100 mils. And it says to infuse over 20 to 30 minutes. Okay. Now I'm just checking the compatibility here. So the diamond hydrogenate is compatible with normal saline. Yeah. And okay. So I'm going to do my med math here to see how much of the medication I need. So 50 milligrams is what I want. And the concentration of this one is 50 milligrams per milliliter. So 50 milligrams over 50 milligrams times 1 milliliter. So that means I'm going to be giving her 1 milliliter of the diamond hydrogenate. Okay. And now I'm just checking the expiry date of this bag here, which is May 16th, so we're still good on that one. And also this one, diamond hydrogenate, which is also May 16th, so that's good as well. So now I'm going to start my medication checks. Okay. So for Rita Wilson, I have diamond hydrogenate, 50 milligrams. which is 1 milliliter. I'm giving it to her intravenously every 4 hours, which she was given it 4 hours ago, so we're safe to do that, as needed for her nausea, and I will be documenting. So Rita Wilson, I have diamond hydrogenate, 50 milligrams per 1 milliliter we'll be giving intravenously every 4 hours as needed for her nausea, and I will be documenting. So, now I'm going to sanitize the top here. For 15 to 30 seconds. Okay. And I'm going to start, oh yeah, I already did my checks. Okay, so now I'm going to get a blunt film needle. I'm going to get a 3 milliliter syringe. That would go into the sharps. And to connect that to the garbage. And I'm just going to prime this syringe. And I'm going to want to put 1 milliliter of air into this vial. Okay. And I've sanitized the lid here. So now I'm putting air into the vial. And now I'm going to be taking out 1 milliliter. Just getting all my air bubbles out. Perfect. Okay, recap my needle here. So I have 1 ml of diamond hydrogenate. So I'm going to do my last check here. So Rita Wilson, I have diamond hydrogenate, 50 milligrams, so 1 milliliter, intravenously every 4 hours, and she was given it 4 hours ago, so it's safe, as needed for her nausea. And I am dotting here. Okay. So that can go away over here now. I've done my checks. And now I'm going to inject it into the mini bag. I'm just checking the expiry date again, which is May 16th, so we're good, and it is compatible. Sanitize for 15 to 30 seconds. Okay, and I'm taking off my cap. And I'm injecting it into the mini bag. Alright. Recapping my needle into the sharps. Now I'm going to mix up my bag here. Okay. Now that it's all mixed, I'm going to write up a medication added IV card. So the patient here is Rita Wilson. Room number is 336. The drug is diamond hydrogenate. And the amount is 15 milligrams, added by Rihanna Wittick. The date is February 10th, 2016. The time is 08 o'clock. Start time, 08 o'clock. Okay, and the flow rate. The flow rate's going to be 200 mils per hour because we want it to infuse over 30 minutes, and we have a 100 ml mini bag, so flow rate is going to be 200 mils per hour. And the expiry date is May 16th, May 16th. All right. I'm going to show my medication card here. Okay. And I'm going to add this to the mini bag. I'm going to put this on the back so that you can still read the label on the front. Okay. Alright, so we're all good there. This is good. And this over there. So now I'm going to set up my tubing. This is to hang the primary bag. And okay. Alright. I'm going to clamp the tubing here. And I'm just going to maintain sterility of my spike here. Okay. Squeeze a couple drops into here. Find my IV tubing. Okay. Okay, so now it's all primed. I'm going to take this and some alcohol swabs and the MAR to the bedside. Okay. Okay. So hi, Mrs. Wilson. I have your gravel for you here.
Perfect.
So can I get you to please tell me your full name and your date of birth?
Rita Wilson, January 23rd, 1944.
Okay, perfect. So I'm just going to set this up here for you. I'm hanging the secondary bag higher than the primary bag. Okay, now I'm going to hook up the tubing. So I'm going to get an alcohol swab. Find my tubing that I want. There we go. And I'm going to be connecting it to this Y port up here. I'm going to be sanitizing for 30 seconds, 15 to 30 seconds. Okay. Okay, open clamps and keep the give it occlusion. Okay. Now that I've sanitized, I'm going to take this off here and put it on. There we go. And I'm going to take the clamp off. And now I'm going to set the secondary bag here. So I'm going to stop this, review program, program secondary, and then dye, and then hydrogenate. Diamond hydrogenate there. And I'm going to program the mils per hour mode. So it's yes, it's the correct drug here. And secondary bag, okay. So now I'm going to put the rate. So we said that the rate was 200 mils per hour. because we want the 100 ml bag to infuse in 30 minutes. It's 200 mils per hour. Okay. And then the volume to be infused, 100 mils. Okay. Call back at the end of secondary infusion, yes. And run. And yes, the drops are falling here, so yes. And there we go, it's infusing now. Alrighty. So here, stream conclusion. This one here. Okay. Yes, okay, there we go. Alrighty, so now I'm just going to finish my assessment with the cat's purr. So P, I'm just checking that that pump is working. Okay, so we got pump here, the pump is working. So yeah, we're good. Okay, so then we want R, so we have the right rate. So right here, we have the secondaries infusing at 200 mils per hour right here, and so that's the right rate. And then I'm also checking that the tubing's all right, it's all patent, everything's good. Okay, and then now I'm just going to be coming back in 30 minutes to check the patient, 15 to 30 minutes when the machine calls me back. Okay, so Mrs. Wilson, do you have any other questions for me?
No, that's everything.
No? Okay,
Can't wait for
perfect.
this gravel to start working.
I know, so I'm going to come back and check you and reassess you to see if you feel a little bit better and less nausea and everything, okay?
Okay, thank
Okay,
you.
so your bed is in the lowest position still, and the side rails are up as well, and your call bell is handy too. Okay.
Thank you very much.
Yeah, thank you. So now I'm coming back to my med cart, and I'm going to document. So right here I'm writing that the dose was 50 milligrams, and the route was IV, and the time was 0800. And my initials are RWBSN2. Alrighty, documenting is done. Okay. Ta-da!
Thank God.